introduce this?
Hang on one second. I just want to get to a couple of the slides.
All right. So Deb's pulling up some slides and we're going to
And my phone, yeah.
Welcome
Welcome everybody.
we're actually, I was like, Deb, do you want to start this? And she didn't know I was hitting record. So
I didn't realize at that moment. I apologize.
So another theme that has emerged, not as broadly, not as much as we'd like to see, but it's still there. And that is this one was specifically called Understanding the Science of Wellness. But this umbrella term of wellness in regards to how the brain and the body work together. And they did cover in this particular session several things. They talked about they dissected how the brain works and how it responds to inflammation, which then is a receptor to pain. Although they didn't focus so much on the pain as much as how it creates inflammation. They talked about sleep. They talked about some diet. They talked about exercise. So they covered a lot of stuff. But I'm going to turn it over to you two to kind of start talking about it, and then I will fill in.
Sure, absolutely. So yes, they did talk about the dynamics of all the different pieces of the brain, the hippocampus, the hypothalamus, all of those different things.
The hippo and the hypo and the...
I know. And I actually texted these guys because they were talking about, it had to do with sleep and your eating and your brain fog, which is where I'm at right now. So apologize. But it was talking about that. I said, I think I think it was the hypothalamus. I said, it's got to be really messed up. But the one thing that I really enjoyed was that she called it the SEC model, SEC. And it was dealing with the sensory functioning, the emotional functioning, and the cognitive functioning. And it was really well done. And she talked about each of those sections and what each one of those sections applies to, which was, extraordinary. And, she talked about the adrenals and the pituitary glands and the hypothalamus, but she said what can't be lost is the hippocampus, because the hippocampus has a lot to do with the inflammatory process as well. So it was really, really good and very scientific as far as the different parts of the brain. And the other section I really enjoyed was the end. But Patrice, do you want to talk about the middle too?
I'll add something to what you just talked about, Deb, if while we're still on it, because I'm looking at the notes and I was
that's what I said. I was taking the photos of all the slides because they didn't post the slides. So I said, I'm never going to keep up with notes. I said, I can picture Tiffany's fingers flying.
I am a fast typer. And there are parts that I literally said, just ... go back, ... go back, to go back to the recording, because it was just, there was a lot of big words too. And
yes,
that was one of which was psychoneuroimmunology. And she called it PNI. And that was literally she said the brain body link that communicates via the neurotransmitters and different cytokines in our body, and how our stress, when we're stressed out, it will disrupt and dysregulate the systems in the brain that Deb was talking about. So Deb has a lot of screenshots. They had really good graphics.
They did.
The different parts.
Excellent.
The different parts of our brain. And I was able to snip a couple things here. They said some things to note were that inflammatory disorders are connected between our mind and our body in one big system. And that's really what this session focused on, was how what's happening. But if we're stressed, or we're angry, or we don't have enough sleep, or these outside factors, anxiety, depression, all of these things that are happening sort of that are occurring in our brain, and how it's creating inflammation in our bodies. And so they looked at a few studies. One was depression, and looking at patients who were biologic naive, so they hadn't been on medications yet, that they had depression, versus were not depressed before they started, and the ones that, and it showed that patients who started with depression were less improved within 3 months. So that alone was just an interesting study. But going to what Deb said on the different parts of the brain, she called the limbic the emotional
Mhm.
switchboard, which I
Mhm.
liked. I typed the
I loved
emotional
it.
switchboard of the brain, and it was this front part of your brain, and she said it was responsible for attention, abstract thinking, and so and it developed, that part of your brain develops through age 25. But then there's another part, and I'll butcher it if I try to say it, so we'll have to refer to the graphic. But it's
Mhm.
responsible for your anger, your anxiety, and your fear. And
Yep.
that part of your brain actually overrides messages that are happening in that front
Mhm.
part that is the abstract thinking and the attention. So it's overrides, it's stronger. The
Mhm.
receptors are stronger. And so it's showing, and then it says the hypothalamus is the great connector of all of those areas, and that controls your sleep, your appetite, and your temperature. And then the hippo, the
Yep.
hippocampus is memory, mood, and learning. And she called it the
Mhm.
brain filing cabinet, which I just
Mhm.
loved these. I had
She
great
was so good.
images
Yes,
of
I
this.
know. Me,
And
I do too.
all of these are working in conjunction, so that when we have these external anxiety, depression,
Mhm.
these mood changes, deprivation of sleep, it's triggering a barrier. They called it a blood brain barrier, but it triggers over a barrier that releases different cytokines and inflammatory markers that then come out in our diseases. And so that's
Yep.
just was really fascinating. And I am reaching out to the really good speaker. She was a rheumatologist, and she's the one that had all these great explanations. And I'm going to ask her if she can come and talk to our group and a little bit more,
Which
because
she would be phenomenal. And
Oh
I just
yeah.
remember she talked about this one part. It was a study that was done, and it talked about if you didn't get enough sleep, that you're going to be negatively, you're not going to recover overnight, because overnight you've got, and I don't have all the notes in front of me or the slides, but um, typically overnight you have this healing, and it's this healing
Right.
effect. And it if you are sleep deprived, that healing and the lower inflammation doesn't doesn't happen.
Yeah.
Again, she talked about, it was just it was filled the entire time. I wasn't taking notes because I was taking the photos because I knew I was never going to keep up,
Yeah.
but it was just
Yeah.
amazing.
She said that when you sleep, you have cellular debris in your body that goes on all day. And when you go to sleep, your sleep flushes these out. And when you can't sleep, you can't get rid of that.
Mhm.
And that's why when you have disruption, I have insomnia, so I knew exactly what she was
Oh yeah.
alluding to. And she said, so when you can't clean out the cellular debris for sleep disruption, it gives decreased cell survival, and we need cell survival to carry on.
Mm-hmm.
yeah,
Yeah,
she called it
absolutely. It
that's
was.
exactly what I had written down as well, that sleep helps heal the cells and improves the lymphatic system, and increases, well, now
The
we're just getting
tau
science.
accumulation.
I don't
Yeah,
know what that
it
all
was the
means.
tau.
It is.
I
It's
know.
TAU. I wrote it out, but I don't
Yes,
know what it means.
accumulation. Yeah, the tau accumulation. So yeah,
But
it,
then,
it was.
but then she also said that because of that happening and not being able to get all of the toxins out, that creates inflammation. And she literally
Mhm.
said the term brain fog. I heard it.
I did too.
Yeah, me too.
Yep. Yep. Yeah. And she said that when you're sleep deprived, she said, well, it goes very scientific, but it inhibits the cellular repair mechanisms, which increases the inflammatory response and decreases the cell survival.
Yeah.
So, I mean, holy cow. So, I mean, a lot of us don't sleep well. And yeah, I think all three of us are major proponents of that. So, I mean, holy cow, we're not doing ourselves any favors. But I think when you use medications to induce the sleep, it's a different kind of sleep, you know? I might be wrong on that, but that is my understanding, is that when you're medically using medication to put yourself to sleep, you're not going into certain sleep cycles. So I think you may not be getting that repair.
Yeah. When I have a BA degree in psychology, and we study, I can't remember if it was my junior or senior year, in one of my classes, it was actually based on all the sleep and the different phases, from when you fall asleep to when you're starting that kind of dreamy phase to when you're in that deep sleep. It's called REM. That's all I remember. College was a long time ago.
Oh yeah. Rapid eye movement. Yeah.
Yes, there you go. Thank you.
I knew that one.
To where you're actually kind of coming out of that and coming more conscious or aware. So yeah, very informative.
Something else that I'm sitting here looking over my notes here, and it was, again, this, I'm going to say her name because she was awesome. Dr. Elizabeth Perkins. I'm coming after you.
Yes, amazing.
She was amazing. So she when she came back on, and then she also said, we've all, no, I've heard of it. I don't know that everybody's heard of it, but there's a lot of environmental factors that trigger autoimmune specifically. So when we're talking about the two sides of the immune system, you have the autoimmune diseases, you have the autoinflammatory diseases, and we cover both, but they're both parts of the immune system. There's two different halves. And autoinflammatory is innate, meaning there is no real known reason why it's caused. But with autoimmune, or the adaptive part of the brain, there has to be an environmental trigger. Something has to trigger it, and it mixes with your genetic makeup. So that's the difference between an autoinflammatory and an autoimmune. And so one of the things that is known trigger of autoimmune is high stress. And she said, I can't tell you how many times that I've had a patient say, I feel like all of this started after XYZ.
Yeah.
And
exactly.
I have said the same thing. I know when I had onset, it was like the perfect storm of terrible things that happened in my life. And I felt like I was just at ground zero. And then all of a sudden I had onset to top it off. And I kept thinking, oh, here we go. Now what's wrong with me? But now that I know that stress is extreme stress. And that's why a lot of women after childbirth also are triggered. So
and
it's
mine was
physical or
surgery.
emotional.
Right. Mine was surgery.
And I think we discussed this, I don't want to get too drawn out, in another podcast where I was saying that mine was, my parents died within each other, and then settling their estates, and then being dragged through probate court and trying to settle that. And, it was just one thing after another. And within a year, maybe a half year after all that, onset.
So yeah, and she said stress sets off an inflammatory chain reaction that ends with multiple adverse consequences. And there is a slide, because I wrote look at slide. So I'll have to look at that slide.
It's coming. I've got them on my phone.
And then it says brain function. Stress causes cytokines to go up, and the cytokines are, if you think of biologics, and you'll see, biologics target different areas, different molecules, and the cytokines are kind of part of this whole process of how we're targeting inflammation and creating treatments. So the stress causes cytokines to go up, and then the inflammation increases. And I guess that's the HIPAA axis, because I wrote HPA. So I think that's what she said, but I have to verify that.
HPA. Sorry.
HPA. Okay. So the
HHPA axis.
What does that stand for?
I don't know.
Oh,
I have to go back and take a look at it. Sorry.
So the path between the brain and the immune system will affect development, and in turn affect the patient. So anyway, it was just a lot of this brain, and it was really fascinating.
And she actually made the comment that people are saying it's all in your head. And she said that. And I mean, if you guys have heard to several of our other podcasts, we had a whole section on that from EULAR directly related to
Yes.
pain. And like, I wanted to text you guys, but I didn't want to miss taking photos. So I was like, oh my gosh, she's so good. And she actually, I feel like she's a younger person and she can speak the medical lingo, but she can also bring it down into, reasonable terms that everybody can understand. So I think she would be fabulous for us.
All right.
And at the end of this section, there was the anti-inflammatory wellness behavior examples that they went into, and that might be for another section. Again, we want these to be short, but this is
you just took the words out of my mouth. That's what I went, oops, because I was going to say, well, they went into that, but we had other sessions with exercise and diet. So let's cut this one off and wrap that into a different review.
Great idea.
All right. So I'm gonna close this one off because we have hit the 15-minute marker on this one, and we'll come back with more updates.
Absolutely.
Let me hit, don't say anything bad. I'm still recording. Not that they would. I'm just kidding. Okay.
Never.
Stop. All right.